Hello and welcome to today's webinar. This is the SFHSS Medicare Retiree General Health Plans overview. My name is Brian Rodriguez. I am the Systems Administrator and Project Manager for the San Francisco Health Service System. And again, thank you for being here today. A little bit of housekeeping first before we start with today's video. If we could go to the next slide. Just wanted to let you know that you will be on mute for the entire presentation today. That means you'll only be hearing what we present to you. And if you have any questions that you would like answered, whether it be from HSS or from our vendor partners, what you want to do is take a look for that chat box that's up in your menu bar. It looks like two chat bubbles with a question mark in it. You can click on that, and you'll get to the live event Q&A, and you'll be able to type in your questions to that, and then it'll either be answered on screen or potentially in the chat, and then we'll also mention it on screen. And if you have any questions that are a little more complex or a little more personal in nature, we do request that you go to our website so that you can schedule one-on-one with our vendors, or you can give a call to the HSS member services. So again, any questions you may have, and we'll try to get to as many of your questions as possible, please do put them into the Q&A chat. And without further ado, let's go ahead and get to the video.
Hi, my name is Kathy Frierson. I have been with the Health Service System for over 21 years, and I am one of 25 benefit analysts who answer your calls when you have questions about your benefits. If you're thinking about retiring, as I am as well, please remember to set up a meeting with your retirement system. And if you are over age 65, please make sure you have your Medicare A and B in place before scheduling your appointment with the San Francisco Health Service System. If you're already retired, many retirees call us to help them navigate their benefits through life events like marriage, divorce, or moving to another area. We here at Health Service System are here to guide you through this important time of your life. This webinar will explain the Medicare health insurance benefits options. If you ever have questions, you can always call Health Service System. Take care, be safe, and stay healthy. Thank you.
Hello and welcome. To find your healthy place, you and your family need high quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan, which makes your life easier. Today, I'll be highlighting your plan benefits, our integrated quality care, digital care options, and membership perks. This information will help you select with confidence the right health plan for you and your family. Now, are you ready to get started? Great, let's begin. We can help you get to your healthy place, no matter where it is. We combine care and coverage, which makes us different than your other healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you through our electronic health record. They can see your health histories, such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, or even pick up your prescriptions all without leaving the building. Care feels easier and faster and is centered around you. Having a doctor you connect with is essential to getting excellent care. Your personal doctor is the biggest advocate for your health and will help coordinate the care you need to get healthy and stay healthy. Members can choose or change doctors at any time for any reason by browsing our online profiles at kp.org/search doctors. You have the freedom to choose a physician that best meets your needs. You can search doctors accepting new patients by gender, location, languages spoken, and even view their photos, education, and credentials. Next, let's review how we're leveraging technology to provide convenient ways to get care. When you need care, you can have an appointment in person with your physician, over the phone, or video. You can get advice 24/7 over the phone, online through an e-visit, or email your doctor's office with a non-urgent question and get a response within 2 business days. You can also manage your care at your fingertips anytime and anywhere. Schedule or cancel routine appointments online, refill most prescriptions, check most lab results, and even pay your bill. Next, let's look at the many care options while away from home. Since keeping you safe and healthy is our first priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at minute clinics or Concentra urgent care centers when you're traveling outside of a Kaiser Permanente area. If you seek urgent care at a minute clinic or Concentra urgent care center in a state where there's a Kaiser Permanente facility, but you're outside of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, contact the Away From Home travel line, available 24 hours a day, 7 days a week, and visit kp.org/travel. Now let's review some of the membership perks to help you feel your best. Good health goes beyond the doctor's office. Here are some of the wellness resources available at little or no cost to help you thrive. Members can take advantage of our health education classes, wellness coaching by phone, and online wellness tools to improve their health and save money. In addition, you can stay physically and mentally fit with these wellness offerings. ClassPass, which provides on-demand video workouts and live stream fitness classes, including Pilates, dance, and boxing. And self-care apps such as Calm, to practice mindfulness with guided meditations, relaxing music, and sleep stories. Lastly, get special rates on a variety of services and gym memberships through our Choose Healthy program. These include specialty care services such as acupuncture, chiropractic care, and massage therapy. Now, let's look at a high-level overview of your Kaiser Permanente Senior Advantage plan with the City and County of San Francisco. This plan offers comprehensive coverage at a copay or coinsurance. There's no annual deductible, and the out-of-pocket maximum is $1,500 for an individual or $3,000 for a family. This is the most you'll pay out of pocket for most covered services during the accumulation period. Preventive care is covered at 100%. Office visits are a $20 copay per visit. You can save money with phone and video visits with your doctor, which is offered at no cost. Hospitalization is a $100 copay per admission. Emergency care is a $50 copay per visit. And lastly, prescription medication up to a 30-day supply is a $5 copay for generic, a $15 copay for brand name, and a 20% coinsurance not to exceed $100 for specialty. If you take routine medications, speak with your doctor about our mail order service to receive up to a 100-day supply for only twice the copay. Next, let's look at other benefits offered through your plan. Your plan also covers hearing aids, acupuncture, and chiropractic care. For hearing aids, you get a $2,500 allowance for each ear every 36 months. Chiropractic and acupuncture care are offered through the American Specialty Health Network. No referral is needed. You're eligible for 30 combined visits per year at a $15 copay per visit. To find a participating provider, use the link or the phone number provided here. Now let's highlight some additional benefits for retirees of the City and County of San Francisco. These benefits are offered to you at no cost. The Silver and Fit exercise program can help you stay active by joining a participating fitness center or trying our home fitness kits. The Medicare Meals benefits provide fresh, healthy meals delivered to your home immediately following an inpatient stay at a hospital or skilled nursing facility. Your plan covers 84 meals per year. And lastly, you can get a ride to and from your appointments with your transportation benefit. Your plan covers up to 24 one-way trips, 50 miles per trip per calendar year. Now, in case you're new to Kaiser Permanente, let's go over what you can expect when you join. As soon as you join, we want to make your care experience easier. We provide personalized onboarding with a welcome call and a member guide, so it is easy to get started. You can also visit kp.org/new member to get registered, choose your new doctor, transition your care and your prescriptions seamlessly, and schedule your first appointment. If you're switching from another health plan, we'll help you with the transfer of your medical records and prescriptions. If you still have questions, we're here to support you. Choosing a health plan is a big decision, but you don't have to make it alone. We're here to answer any of your questions so you can make an informed decision. If you have questions about the essentials or the extra features, call the number listed on the screen. For additional information and plan documents, please visit the microsite listed on the slide, where you'll find content tailored specially for City and County of San Francisco retirees. Thank you for your time and attention. Today, we reviewed the benefit of choosing Kaiser Permanente, the resources to help manage your plan, and membership perks available at little or no cost. Now you have the information you need to select with confidence Kaiser Permanente as your health plan. We look forward to providing quality, integrated care for you and your family very soon. May you live well, be well, and thrive.
Welcome, and thank you for taking your time today to learn more about the United Healthcare Group Medicare Advantage PPO plans designed specifically for San Francisco Health Service System retirees. There is a plan available for those of you with Medicare Parts A and B, and another plan for those of you with Medicare Part B only. Both plans have the same benefits and coverage. During our time together today, we will be reviewing your plan benefits and what to expect next if you decide to change enrollment. To learn more about the United Healthcare programs and features that are also available with these plans, please consider joining one of the additional presentations. The United Healthcare Group Medicare Advantage PPO plans will cover all of the benefits of Part A, your inpatient hospital, skilled nursing, and home health, as well as all the benefits of Part B, your doctor's office visits, outpatient care, and labs, and the Part B prescription drug coverage. As well, we offer many additional benefits and programs. You are still considered to be covered by Medicare, but all of your benefits and claims will be administered by United Healthcare. Your United Healthcare Group Medicare Advantage PPO plans are national PPO plans. What that means to you is that you will be able to see doctors, clinics, and hospitals all across the United States and the U.S. territories. Under the plans, there will be coverage for podiatry, vision, hearing, chiropractic care, and acupuncture, as well as prescription drug coverage. There are no referrals needed to see a specialist. The national PPO plan lets you see providers in or out of the United Healthcare network for the same cost to you as long as the out-of-network provider participates in Medicare and accepts the plan. This means they are willing to bill United Healthcare. The provider you are currently seeing may already be in the United Healthcare network under your plan. To confirm if your provider is in the network, you can check online at www.uhcretiree.com/SFHSS or by calling United Healthcare Customer Service at 1-877-259-0493. The customer service team may also be able to assist by confirming if your provider participates in Medicare and accepts the plan. Now I will discuss the specific copays you pay per service. If you seek service with your primary care doctor, you will pay a $5 copay. For a specialist office visit, you will pay a $15 copay. When you go to an urgent care facility, you will pay a $20 copay. You will pay a $65 copay when you visit the emergency room. The copays for urgent care and emergency care are waived if you are admitted within 24 hours. You will pay a $150 copay for each hospital stay, and you will pay a $100 copay for outpatient surgery. Under this plan, all preventive services such as annual physicals, immunizations, breast cancer screenings, and colon cancer screenings are covered at no cost to you. This slide shows some of the additional benefits included with the plan. You are covered for routine foot care for up to 6 visits per year. Your cost is a $15 copay per visit. Your routine hearing coverage provides 1 hearing exam per year at no cost to you, and you have a $5,000 hearing aid allowance every 3 years. You are covered for 1 routine eye exam per year, and you will pay a $15 copay at that visit. You have an allowance of up to 24 routine chiropractic visits per year, and you will pay a $15 copay per visit. You also have up to 24 acupuncture visits per year, and you will pay a $15 copay per visit. Your plan includes prescription drug coverage, or Part D. You have the option of using over 67,000 United Healthcare in-network pharmacies. There are thousands of covered brand name and generic prescription drugs available. You can check the plan's covered prescription drugs by going to www.uhcretiree.com/SFHSS or by calling customer service to review your prescriptions. The customer service phone number is 1-877-259-0493. This slide shows what you will pay for prescription drugs. Tier 1 includes all covered generic drugs, and you will pay a $5 copay for a 30-day supply at retail or a $10 copay for a 90-day supply through mail order. Tier 2 includes many brand name drugs called preferred brands, and you will pay a $20 copay for a 30-day supply at retail or a $40 copay for a 90-day supply through mail order. Tier 3 includes non-preferred brands, and you will pay a $45 copay for a 30-day supply at retail or a $90 copay for a 90-day supply through mail order. Tier 4 includes specialty drugs, and you will pay a $20 copay for a 30-day supply at retail or a $40 copay for a 90-day supply through mail order. There may be more ways that you can save under the plan. One of them is by reviewing your medications at least yearly with your doctor. Maybe a generic or less costly drug has been developed that will help you stay healthy that can also reduce your costs. Be sure to use your United Healthcare ID card when you go to the pharmacy, and make sure you use a participating pharmacy. You can also choose to use the OptumRx mail order and receive the 90-day supply of your medication for just 2 copays instead of 3, which will not only save you money, but also the added convenience that your medications are delivered directly to your home. If you are already a member of a United Healthcare Group Medicare Advantage PPO plan and you are happy with the plan, you do not need to do anything and you will remain enrolled for the 2022 plan year. Both newly enrolled members and those who are already enrolled will receive a new member ID card in December along with a quick start guide that gives you more information on how to get the most out of your plan. You can start using your member ID card on January 1 of 2022. We do encourage you to register online at www.uhcretiree.com/SFHSS to access your plan information, view claims, and get your explanation of benefits online. You will need your member ID card to register. If you are new to the plan, we will contact you soon after your effective date to welcome you to the plan. United Healthcare wants you to know that your benefits through San Francisco Health Service System do offer you much more than the coverage discussed in this presentation. We recommend you consider joining another presentation to learn more about the additional plan benefits, programs, and features available to you as a member of our plan. Or, if you would rather review the information on your own time, you can do so through our virtual education center. You can view online flyers, brochures, and videos all by going to www.uhcvirtualretiree.com/SFHSS. On behalf of United Healthcare, we want to thank you for your time today, and we look forward to welcoming you to our Medicare family. If you're already a member, we welcome the opportunity to continue to serve you. Thank you for listening.
Hi, I'm Carrie Bashirs, Wellbeing Manager with the San Francisco Health Service System. Today, I'll spend a few minutes with you highlighting some of the free wellbeing resources available to our retirees. First, I'd like to highlight some of our support programs that we offer. First is a diabetes prevention program, which is a year-long program in which you would need to pre-qualify. We also have a Healthy Habits offering. It's a 10-week program that focuses on healthy weight or weight management. Also, it addresses topics like sleep, physical activity, and healthy eating. We also offer lifestyle coaching. And then currently during the flu season, we offer on-site flu clinics at various worksite locations. So go ahead and get a scheduled appointment today. We'll start flu clinics in September and run through November. Additionally, we do offer some resources that you can check out. First is Credible Mind. It's a resource hub that offers over thousands of different articles, newsletters, apps, blogs that you can search on various topics that are most relevant to you that focus on mental health and well-being. We also offer webinars and classes. You can attend those virtually right now. So seminars might be things that focus on resiliency or mindfulness or even healthy eating. Classes, also group exercise classes. And then we do offer gym discounts. And then most recently, we've launched a website page that focuses on social connectedness. So you can find ways to connect and empower, look at what's available in your community, and really just try to stay connected in these times. So for more information, please feel free to contact us at WELL-BEING@sfgov.org or give us a call at 628-652-4650.
Okay, now comes the time where we will answer your questions that have been posted to the Q&A. So let me go ahead and open that up and we start reading the first one. Okay, the first one is, it was mentioned that if you are over 65, you need to have your Medicare Part A and Part B in place. I thought that if you sign up for Medicare when you retire within 1 month, please clarify. I'm over 65 and have not signed up for Medicare. I am planning on retiring within the next 6 months. Sonali had answered that. Thank you, Sonali. I'll just read her response here. If you are still an active employee, we do not require you to enroll in Medicare right now. However, if you plan on retiring, you will need Medicare Part A and B to be eligible for retiree medical benefits. We recommend you call HSS 3 months before you plan to retire, and we can help you with the applicable forms and to facilitate with enrolling in Medicare. And then definitely for more information and the forms, you can look at our website, sfhss.org. All right, and the next one is, do we have to register to the plan even if you are a current Kaiser Permanente member? And I see that Jessica is typing a request to this, but when you retire, yes, you will need to make sure that you are signing up for the retiree plan. So that's a definite yes on that one. And what is the difference between Kaiser Permanente Advantage with CCSF and the one advertised on TV? Let's see, I think I will take a look at that one. I will pass that off to Julie just to give a little more clarification on that one. So Julie, if you could take that one.
Sure. The benefits, sorry, I'm just totally out of it right now. The plan that we have that we shared today is specifically for City and County of San Francisco retirees. So it is designed for the retirees. The board and HSS determine the benefits and the co-payments, et cetera. It is different from the ones that are advertised on TV because those are geared towards people who usually do not have health coverage in retirement. So they're going to have different benefits, they're going to have some different co-payments, et cetera.
Okay, great, thank you. And we move on to the next question, which is, do any of the Medicare plans provide out of California coverage? I'm planning on moving to another state after I retire, and this is an important consideration for selecting my health plan. Currently, the United Healthcare Medicare Advantage plan provides the coverage outside of California. I do know that Kaiser Senior Advantage is available in Washington, Hawaii, and Oregon. So those would be your options if you were moving to one of those 3 states. But outside of those 3 states in California would be the United Healthcare Medicare Advantage plan. And then the next question is, how can I just change vision coverage? With all of our plans to have the VSP vision coverage, you must be enrolled into a medical plan. And that's how you get the free VSP coverage. There is also the option to do the Vision Premier with VSP, but again, you must be enrolled into a medical plan in order to have vision coverage. And okay, the next question is, what is the copay or charge for labs? So that is definitely available on our website at sfhss.org. But I will ask both plans to answer that question. I'll go back to Kaiser first.
So there's no charge for labs or x-rays or any of that.
Okay, and then United Healthcare, please.
And also for United Healthcare, there's no charge for labs and x-rays.
Great. All right, and going on to the next question is, I'll be turning 65 in December, and I'm currently in the process of enrolling in Medicare. I'm with Blue Shield right now. Will I automatically be enrolled in the United Healthcare PPO? What do I need to do during open enrollment? And again, thank you, Sonali, for answering this. And I'll just read the question, or excuse me, I'll read the answer out again. It just says, once you enroll, please provide the proof of Medicare enrollment to HSS 1 month prior to turning 65. You will then be automatically enrolled in UHC Medicare Advantage plan. And open enrollment is for making changes to your plans for the next plan year. So the open enrollment right now is for plan year 2022. If you wish to change to Kaiser for the next year or make any dental or vision changes, that's when you would do that during the open enrollment period. All right, and then I'm going to move on. The question is, so there are only two Medicare Advantage plans through Kaiser and United Healthcare. And yes, that is correct. Those are our two Medicare Advantage plans that we have for retirees at this moment. And we have the next question is, are the services in the Advantage plans same as or different / less than fee-for-service Medicare? Again, I will ask the plans to answer that question for me. This time I will start with United Healthcare.
Sorry, this is for infusion therapy?
This is this question specifically, are the services in the Advantage plans the same as or different than fee-for-service Medicare?
Okay, so if I'm interpreting the question is really comparing, this is a Medicare Advantage plan, and you also have the opportunity to go outside of San Francisco to join a supplement plan. I think that's what they're asking, is to compare the two and if the services are the same. And from a United Healthcare perspective, I mean, we would cover everything that Medicare covers on this plan as well as on a supplement plan. So hopefully that's answering the question.
Okay, thank you. And next to Kaiser to answer the same question.
Yeah, so similar to United, our Medicare plan is a Medicare Advantage plan. And with Medicare Advantage plans, you get all of your Part A and B services. And in both of our plans, you get additional services as well. If you are doing fee for service, then you have original Medicare, and there would be any applicable deductibles or coinsurance, which on our plans, there's no deductible and very low co-payments.
Okay, great. The next question is, what is the charge for infusion therapy? And Kaiser, since you just went, I'll ask you just to keep your mic open and answer that question.
I believe there is no charge. I am just gonna, I'll put it in the chat. I'll quickly look that up, but I believe no charge.
Great, and United Healthcare, same question.
I am also having to look that up, so just one moment here.
Sure. And while you do that, I can answer the next question real quick, which is, do I have to send proof of Medicare enrollment to HSS? Yes, you do. You can do that either by mailing it to us, or you can also fax it in to area code 628-652-4701. So either one is acceptable. And also a follow-up to that is you need to submit the Medicare card or the award letter 1 month prior to turning 65.
Brian, on the infusion therapy, I do believe it's covered under the Part B. So and if it's in the provider's office, that would typically mean that the office visit copay would apply. So depending on the type of provider that they see for that.
Okay.
Could be like a $5 copay or a $15 for the specialist.
Okay, great. Thank you. And I will move on to the next question. This was specifically, I believe, about, I plan on retiring on May 5th. Is it just wait for 3 months before I retire and re-enroll in the health plan? So I will ask either Sonali or Jessica to answer that one on behalf of HSS.
Brian, please can you repeat that question one more time?
This member says he plans on retiring on May 5th, 2022. Is it just wait for the 3 months and before retiring and then re-enroll in the health plan?
So if the member is retiring next March 2022, I would recommend the member to call us at least by January to help us take a look at his account and advise further. So call HSS at 628-652-4700.
Great. Thank you, Sonali.
Thank you.
Right. The next question, and this is for Kaiser. I'm an early retiree with Kaiser Permanente. Should I choose Kaiser Permanente Advantage Plan now or wait until I am 65? Please advise.
You're an early retiree now, so you're not 65? So if you're not 65 and you're not eligible for Medicare under some other criteria, like you're disabled or you have end-stage renal disease, then you cannot enroll in Medicare until you turn 65.
Okay, thank you for that clarification. The next question is, does the change to Blue Shield, Blue Shield this year, change the option from United Healthcare? And again, Jessica and Sonali can correct me if I'm wrong on this one, but as I understand it, the change from United Healthcare to Blue Shield is for the PPO plan that is available to active employees and early retirees.
That's correct. So if the member currently has United Healthcare PPO as an early retiree and not the Medicare Advantage plan, they will get the Blue Shield of California PPO accolade in January. And when they become Medicare eligible, they can select either the Kaiser Senior Advantage Plan or the United Healthcare Medicare Advantage Plan.
Great, thank you. And okay, the next one is please post the fax number on the chat. Sonali is in the process of doing that. I'll just say it audibly here again. It is area code 628-652-4701. All right, next question is, as a retiree, I need to sign up for Medicare by the end of January 2022. What will happen to my spouse once I am on Medicare? She is not 65 years old until fall 2022. And again, I will
I can do that.
Defer definitely.
Perfect. So that's a really great question. When you sign up for a Medicare account, let's say if you choose the Kaiser Permanente Medicare Advantage Plan, then your spouse, who is not yet Medicare eligible, will be able to sign up for the Kaiser Permanente traditional HMO plan. However, if you choose the United Healthcare Medicare Advantage Plan, the PPO plan with United Healthcare, when you become Medicare eligible, depending on where you live, your spouse can either have and Jan, correct me if I'm wrong, can have the United Healthcare Companion Plan, also the PPO plan. Or if you're in the Bay Area county, they can also sign up for one of the Blue Shield plans. Jan, is that correct? Is that your understanding for United Healthcare Medicare Advantage members?
For the Medicare Advantage members, I don't know, besides our plan, what they could choose? Sorry, I'm kind of confused. Are you talking about because we do have the companion plan available. So if the retiree is Medicare eligible and the partner is not, then they would take the United Healthcare PPO plan.
Yes, that's it. Exactly. So yeah, a lot of it depends on where you live and which plan you're choosing. But your dependent who is not Medicare eligible yet will qualify for one of the plans. It just depends on which plan you are choosing for your Medicare plan. And if you want more information, you can always schedule a consultation with member services.
Okay. Let's see, going on to the next question. This one is, if a procedure is recommended by your physician and it is authorized by regular Medicare, is there a separate review and authorization needed by the Advantage plans? So again, I'll ask each plan to answer that individually. I'll start with United Healthcare.
Sorry, Brian, I missed the question.
Sure. It's if a procedure is recommended by your physician and it is authorized by regular Medicare, is there a separate review and authorization needed by the Advantage plans?
There could be. If our plan does require a prior authorization, then that could be the additional review.
Okay,
Typically,
so it sounds like it depends on the procedure.
It kind of does depend on the procedure, but typically anything that Medicare would cover, we will cover. So it's not usually a concern. It's just a matter of kind of jumping through a little bit of hoops from your provider side, not the retiree side.
Okay. And I'll ask the same question to Kaiser.
Sure. So if a Kaiser doctor is recommending a procedure and it's authorized by regular Medicare, then it will be covered under the Medicare Advantage plan that we have for City and County of San Francisco retirees.
Okay. And looking for the next question.
I think this next question is the follow-up to the previous question.
Yes.
And I have the rates page open. So if the main member becomes Medicare eligible and their dependent is not Medicare eligible, and you're currently on Blue Shield Access Plus, you're currently both on Blue Shield Access Plus, then your choices are to either join one of the Kaiser plans, Kaiser Permanente Senior Advantage, in which case your dependent will need to be in Kaiser Traditional HMO, or you can join the United Healthcare Medicare Advantage plan, and your dependent will need to be on the United Healthcare Companion plan. Both of them are PPO plans.
Okay, thank you, Jessica, for that. The next question was, what is the member services number? And thank you, Sonali, for posting that in the chat. I'll say it audibly here for everybody. To get to HSS member services, please call 628-652-4700. And the next question is, I am 61, early retiree. Can I sign up for the Kaiser Permanente Advantage plan?
I'm assuming you're going to have me answer that.
Yes.
Yeah. No, if you're 61 and you're not eligible for Medicare under some other type of reason, such as disability, ESRD, or Lou Gehrig's disease, you do need to wait until you're 65. That is the age at which you can enroll in a Medicare plan.
Thank you for that clarification. Okay, let me see any other questions coming in. Next question, for the shingles immunization, is it covered at the doctor's office or pharmacy or both? And this is specifically to United Healthcare.
The shingles vaccine is covered at the pharmacy.
Okay, thank you. That is covered at the pharmacy. All right, let me see if there's another question. No other questions currently. So again, feel free to post any questions into the live event Q&A, and we can ask them of our vendors. We do still have some time. And while we're waiting, I will ask the our producer to post in and show on the slide deck, excuse me, the link to the raffle. We have some great prizes this year provided by our vendor partners. So there is a raffle. All you have to do is click on that link or go to that URL, enter your information, you'll be entered into the raffle this year. We've got quite a few things. I've seen a few of them, and they are very nice. So definitely click on that. Make sure you enter for the raffle. And let's see here. Next question. Could you speak to how to get medical care? Sorry, my just went away. Can you speak to how to get medical care while traveling outside California and the United States? Good question. I will go first to Kaiser Permanente to answer this one.
Sure. So you have coverage anywhere in the state, the country, or the world, and that is a benefit of your City and County of San Francisco health insurance. So remember that Medicare is not, it's not outside of the country. It's only in the United States. So you're covered for emergency and urgent care outside of your home area. You would just get the care that you need, and then when you're able to, give us a call. You might need to be prepared to pay for that service that you get, but then you give us a call. There's some paperwork that you need to fill out, and you would be reimbursed for everything but your copayment. And then there are a couple of other ways. There's some information you can get online at kp.org/travel. You can get like the paperwork that you might need if you do have a claim. You can get a little kit that would help you understand what you need to do depending on where you are. You can also visit a travel nurse if you're going somewhere where you might need some type of immunization or something. So again, kp.org/travel would be the best place for you to get that information.
Great, thank you. And United Healthcare, same question.
Yes, the care is available to you for urgent and emergently needed services, and that's throughout the U.S. as well as worldwide. And similar to what Kaiser said, if you are outside of the U.S., you may have to pay for those services out of pocket, and then when you are able to, upon returning to the U.S., you can submit those charges to us, and we will reimburse you minus the applicable copay depending on the services that you had.
Okay, great, thank you very much. Let's see what's next here for questions. Okay, looks like we posted the raffle, good. And the next question was, on my enrollment statement, it lists my dependent's medical plan as UHC Medicare Advantage PPO, even though they are not Medicare. And thank you, Sonali, for responding. I will read the response out just for everybody. It says, if your dependent is non-Medicare enrolled in UHC PPO, it will show as UHC Medicare as you are the primary subscriber. So that is a slight nuance just to be aware of. And next question, back to the question on spouse health coverage. If under 65, will the UHC companion rate be posted within the open enrollment period? And I want to say yes, I believe it is up on our website. I will take a look at that. And Sonali, if you know where it is specifically, feel free to jump on in there. But I know that the companion plan rates are on our website. I just need to find it real quick. And someone asked why we need to have supplemental insurance such as KP Advantage and United Health. I'm sure that's a fairly lengthy response, but I will ask each plan to just give a quick response to that, and I can go to Kaiser again first for this one.
It's probably going to be the same answer for both of us. If you, I mean, Medicare is a way that you can get less expensive health insurance coverage when you're 65 or older. And when you are retired, Medicare is going to be primary to your city and county of San Francisco coverage, which will be secondary. You could remain in just original Medicare, but you would have deductibles and co-insurance. These supplements, such as Kaiser and United, really close up the gap in those deductibles and the co-insurance. So you have complete, full, rich coverage as a retiree with the city and county of San Francisco in any of the plans that you choose.
Great, thank you. And United, anything to add, or pretty much the same?
Pretty much the same.
Okay, great, thank you. And then just getting back to the person that asked about the companion plan rates, Sonali had posted our main website. I've also posted the direct link to the retiree rates PDF for this year. So depending on whether you're with Medicare or not yet Medicare eligible, and then also your hire date and things like that, you should be able to see the rates for the UHC companion plan PPO. And the next question is, does Sutter Health, Palo Alto Medical Foundation, are they under United Healthcare? So United Healthcare, I'll ask you to answer that one.
Sorry, what does the PAMF stand for?
Palo Alto Medical Foundation, I believe. And if I'm incorrect on that, feel free to correct me on that one.
I see Sutter Pacific Medical Foundation as participating. And let me see, Palo Alto is coming up or not. We do have many of the Sutter locations in California, so. If I'll keep looking and I can answer too for this specific one.
Okay.
If you want to move to the next question, I'm fine with that.
Sure. Next question is, which plans kick in first to cover our service? I'm going to assume which plan, meaning is it Medicare or the Advantage plan? Which one pays first to cover the service? So I can ask United if you could answer that one first.
Sure. With the Medicare Advantage plan, your providers are only going to be billing either United, I'm pretty sure it's the same for Kaiser, for the services. So there's not a coordination of benefits piece, except for on a few certain services. So, and usually a case manager is involved in that case. So we'll help you out if it comes to that. Like, for example, hospice, that would be something that would get billed directly to Medicare.
Okay, and Kaiser, do you concur?
Julie, I think you're on mute still.
It's been a long week. Yes, I concur. I'll just keep it simple.
All right, thank you. All right. The next question was, with Kaiser Advantage plan, can I see a Kaiser doctor in Kaiser facilities in other states, for example, Hawaii and Oregon?
So if you are moving to another region where City County San Francisco has a contract with us, so that would be Hawaii, Northwest, and Washington, you can actually move all of your care there. If you're just going to be visiting any of these other regions, then you can be a visiting member and you can see doctors and go to Kaiser facilities there while you are temporarily in that service area.
Correct. Thank you. And next question, to be clear, when I file for Medicare at the end of January, I am just filing for Part A and B, nothing else, correct? As far as Medicare is concerned, that is correct. You are just filing for Parts A and B. That's what we require. The next question, is the office closed at this time or open? To reiterate what Sonali has put in there, our offices are currently closed for in-person visits. We are taking assistance over the phone, so definitely give our member services folks a call at 628-652-4700. But again, we do not have any in-person services at this time. The next question, do Hill physicians participate with the United Healthcare Advantage Plan? And I will put that over to United Healthcare.
I would need to know where Hill physicians are located, a city, if I could, please.
Hill physicians, they're within the Bay Area, so I know that they have doctors in San Francisco, East Bay, Contra Costa. So I do know that they're kind of all over the place within the Bay Area.
Thank you. Just a moment. I'm not seeing that they are showing as in-network as a medical group, but that doesn't mean that a provider within them isn't in our network and contracted with us. And then also, you should know that because this is a PPO plan, you can go in and out of network and the benefits are the same to you so long as your provider participates in Medicare and is willing to bill us. So if you wanted to see a Hill Physicians provider, and as long as they're willing to bill us, then that would be fine, and there would be no cost difference for you as a member. And that would be the same that's true if for some reason the retiree asked earlier about Sutter, that if for some reason they weren't showing as in network, but they as long as they're willing to bill us, then you would still be able to be covered the same cost share.
Okay, great, thank you. The next question is it necessary we must get Part D from the Advantage plans? I will ask United Healthcare first.
These plans include prescription drug or Part D coverage, so you do not need to purchase, and you cannot really purchase any additional Part D coverage.
And Kaiser, do you concur?
I concur.
All right, thank you. The next question was, are there any changes to the dental vision benefits when I switch to Medicare? Thank you, Sonali, for answering. No, there will be no changes to your dental or vision coverage. And the next question, being on Medicare and 2 of my dependent children live in Nevada, I'm confirming that they are covered while living there. Definitely you want to give a call to our member services at 628-652-4700 to talk to one of our benefit analysts about that question. Okay, and then next for the additional vision coverage, how much is the monthly premium and what does a retiree get as additional benefit? I'm covered under the United PPO. So I will ask you to take a look at our website, sfhss.org, and then go to the open enrollment page, and you'll be able to see not only the rates, but also what the Vision Premier coverage looks like and what benefits that gives you. Let's see. Okay, does UHC know if Stanford is included with the UHC PPO Advantage?
Let me look here. Again, I'm not seeing them as showing as in our network, but as long as they are participating in Medicare and willing to bill us, that is an option for you to see them.
Okay, thank you. And then the next question was specifically asking on the Hills physicians, as their facilities include the UCSF campuses. And I can actually answer this one because my uncle is a retiree of the city county of San Francisco, and is on the UHC Medicare Advantage plan, and he does go to UCSF. So I do know that they work with the United Healthcare Advantage plan PPO. And then, oh, thank you, Leticia, for posting the raffle link again. We are at 12:01, so I will thank everybody for their time and attention today. This webinar will be posted on our website within a few days, so that if you want to watch it again or have any other questions, you'll be able to have a look. And again, feel free to call our offices at 628-652-4700 with any questions, or take a look at our website, sfhss.org, where you can also set up one-on-one meetings with our vendors. So thank you very much and have a good day.